Thanks so much for joining us for another edition of our Open Mic program. We do have Congressman Rick Crawford with us right now. And Congressman, you know, we've been in broadcasting a long time, and this is kind of a first for me, but it does feel like a giant snowstorm came through because everything is kind of shut down listening to the radio.
Yeah, well, I mean, the good thing is that, you know, your people have you as a resource to be able to tell them what's going on. And so I appreciate the opportunity to visit real quick with you about what's taking place right now.
Well, you know, Governor Asa Hutchinson and Dr. Nate Smith announced no new cases found yesterday at 10:30. 22 still confirmed positive, including 2 cases in Greers Ferry in the Cleveland County area, and they were tied to out-of-state travel. You were at that press conference in West Memphis and also had a meeting. Tell us a little bit about what you're seeing.
Well, I'm seeing a very well-coordinated response across the board. You know, we have this term that we use, this whole-of-government approach. That's taken place at the federal level, and it's certainly taken place at the state level. So the federal government is certainly, everybody's waiting and you know, expecting a strong federal response, and that's what we're getting. But without really good leadership at the state level, then that response is not going to be as good. And so what we have in Arkansas is a very good model that's taken place to help be that multiplier for the federal response. And so I think we're in really good shape because of the leadership of the administration here in Arkansas that's helping to facilitate the federal response in addition to the resources that the state brings to bear. What the state's doing is primarily, you know, the organizing entity here at our level that is kind of coordinating everything and making sure that we have what we need. You know, state and county agencies have what they need, and so on. So Dr. Nate Smith we're very fortunate to have someone of his caliber at the helm there at the health department. So that's good. And I think we should recognize that we're very fortunate to have what we have with regard to the state response, supplementing the federal.
You know, one thing, the Baptist Health Medical System, it controls the Baptist Health Medical Center in Heber Springs, and for Cleveland County residents, they're saying if you think you've been exposed to the coronavirus or exhibiting symptoms, Baptist Health of Heber Springs established a drive-thru screening process located in the back parking lot of the hospital campus in Heber Springs. A drive-thru clinic, of course, you know, we've talked about, is open today from 8 to 8 all the way through Friday, March 20th. That's just some ways that we see as soon as there was exposure and a case that popped up in Cleveland County, they were there almost the next day.
Right. So here's the reason why they're doing this drive-through testing, and this is really important. I think it's essential that your listeners understand why that is. What you don't want to do is go to the hospital. If you have truly been exposed and you go into the hospital, you effectively shut the hospital down because of the protocols that exist for those hospitals. So what they're trying to do is make sure that the most critical areas like hospitals are not infected so that they can continue to serve folks don't have anything to do with corona, but that, you know, obviously need that critical service that the hospitals provide. So what we don't want to do is compromise the hospital's ability to continue to deliver care to everyone else. And so they're setting up these remote testing locations, drive-through locations, to minimize exposure. And it's a fairly straightforward proposition. And, you know, they'll swab. And if you're getting tested, they'll swab. They take 3 samples. And it's all pretty straightforward. There's really nothing to be alarmed about or concerned with. In fact, you probably see drive-through test sites around hospitals all over the state. In fact, maybe even some other locations that are fairly easy to get to. That's critical. You might call that critical infrastructure. We definitely don't want to be in a situation where we disrupt our ability to maintain service in a hospital. That's the reason for it. It's nothing to be concerned about other than that it's an additional service that they're providing in a way that they can manage and minimize exposure to not only to hospitals themselves, but to the medical professionals who are actually out there on the front lines helping to administer this program and the response.
Well, that is true. And for individuals in Cleveland County who have the symptoms, they need to be screened, but they must call ahead. That's something else. It's all organized. So the number to write down is 501. It is
very much so.
Yeah, and then the number is 501-887-3279. We'll have it on our website as well.
That's another important detail. We're trying to do as much of this as we can over the phone. Obviously, you have to be physically present to be tested, but you don't necessarily have to congregate with other people in order to be in the queue. And that's the important part of the whole drive-through model that just minimizes exposure. And then here's the other thing. If you're exhibiting symptoms, and I would encourage you've probably got a link on your website. We certainly do on ours. There are various sources out there. The state has multiple links, and of course, the Department of Health. Really check that out. Find a link, check that out, and really check your symptoms, because there are some unique symptoms associated with COVID-19. And what we're seeing at this time of the year, a lot of time, are seasonal allergies. And so you may think, oh my goodness, I've got the sniffles really bad, or I'm sneezing, or I'm, whatever. Well, that's probably seasonal allergies. I'm not a medical professional, but you don't want to necessarily panic. Go to the website and really look at those symptoms before you get into a situation where you're overly alarmed about something, and then look at the resources you have available, like at the hospital in Heber. But there are other areas that are doing the same thing, that are setting up that drive-through. Number one, to make it easy for you, and number two, to maintain, what we're talking about, social distancing. But we also have to, protect the integrity of the hospital and make sure that it stays open and provides services to everybody else. Because you might have somebody that is in need of critical care. Maybe they're having a heart attack or something, and if we've shut down or closed off the hospital, now we've compromised the hospital's ability to deliver those key services that are still required. Even in an emergency like this, we've still got to focus on delivering health care across the board.
And it also is something, it seems like it's susceptible to the elderly, which that is the KFFB audience. If you look at it around the Greers Ferry Lake and even north,
Sure.
46% of the market is over 50. So that's a big portion of the market and portion of the population.
And that's critical, is that we also recognize that if you're not in that elderly population, the over 65, it's really, if you're over 60, you want to think about this, okay? I mean, if you're over 60, you're still in the workforce, yeah, but think about this, because you are probably more susceptible than someone who's 30. The other thing is, if you have other underlying healthcare issues, you're probably more susceptible than someone who doesn't have any other underlying healthcare issues. So think about that and try to make good choices with regard to where you're going, what you're doing, and, maintaining a good social distancing, making sure that look, the truth is, here in Arkansas, we're a very outgoing, affable people. We like to shake hands. We like to hug. It's a tough thing for us to stop that. And I noticed that we were all kind of trying to stop that in that meeting with the governor and press conference. And there's so many people there that I ordinarily will certainly shake hands with or hug, because we've developed close relationships over the years. And, we're in a position now where we have to sort of stop that. And that's particularly necessary for folks that are in those categories of the higher risk, for example, the senior citizens or the immunocompromised. So be thinking consciously about what you're doing, where you are. If you're not in that category, but you have a loved one who is, then you want to minimize your exposure to that individual. If you are in a situation where you're not in the high-risk category, but you are a care provider for someone in your home who is in that high-risk category, then you need to kind of treat yourself as if you are in that category. So that means when you go out, you need to conduct yourself with a little higher degree of situational awareness that you might not otherwise have, just so that you can protect that individual back in your home. And look, we're going to get past this. This is something that it's an issue that we're dealing with it very well, as good as can be expected under the circumstances. And we've certainly got the resources and that have been brought to bear on this. So I just want to encourage everybody to take just a quick beat to thank God we're where we are in the United States of America, and that we're actually considerably better off than countries, say, for example, like Italy and other European countries. That's a lot to do with the resolve of our country and, the response that we have at the federal and state levels, and everybody working together.
Well, Congressman, I appreciate you taking time and talking with us, as you always keep us up to date. It was good to see you, and I know a lot of folks felt good knowing that you were at that news conference yesterday. And I know the governor will have another news conference today, which will carry, and also the president. We're trying to keep that information flowing, because with information keeps the fears down, and everyone needs to know what's going on.
Absolutely. You just check in with me anytime, and I'll do the same. And I'm here to be a resource for the folks in the 1st District.